Love that music, music of your life, and we're underway here for this Wednesday, helping seniors of Brevard. I'm John Harper, and let me introduce to you the host of Helping Seniors of Brevard and the executive director of the organization as well. The organization being Helping Seniors of Brevard, and here is none other than Kerry Fink. Hi, Kerry.
Hey, John Harper. It is always good to be here and be part of radio every Wednesday. We call it the lunchtime gathering right here on 90.3 FM WEJF Radio. And also hello to those of you who catch us online, WEJF.net, and those who pick this up as a podcast, a growing number that find us on everything from Apple iTunes to Amazon, Hey, Alexa, and those kind of things too. Welcome. Our effort on behalf of our president and founder, Joe Steckler, is always to give you good information that's going to help you create your best aging plan. And what we mean by that, for those of us that live here in Florida, we understand a hurricane plan. Doesn't mean you want to have a hurricane. It just means you're prepared in case one should be bearing down on you. And that's the same idea with an aging plan. We often euphemistically call that getting your ducks in a row, and that's our goal, is to help you do just that by making you aware of things that experience shows along the way would be good to be prepared for. And so today we're going to talk about a lot of different things, but let me first stop down and introduce longtime friend of the Helping Seniors organization. He's an expert, really a noted area nationally recognized periodontist who has a great practice here together with some great colleagues. It's called Solid Bite Dental. Most people also refer to as Dr. Lee Sheldon. How are you today, Dr. Sheldon?
Hey, Kerry, it's good to talk with you. Great. How are you?
I am good. And, you know, I was thinking back, we've covered so many topics along the way. We've talked about dental implants. We've talked about, are too many people getting dental implants? We've talked about periodontists, and we actually did a show I thought was kind of interesting. We did a show as, are too many people getting periodontal treatment? And, you know, as we talk about these things, I really appreciate the fact, Dr. Sheldon, that you're not afraid to go after some of the sacred cows in the room and just make sure that we're really looking out for our seniors really the right way.
No, I think if you talk to anybody in organized dentistry, they wouldn't be surprised about the topics that we're covering here, because it goes beyond Melbourne and Brevard County. It goes to other areas as well, and part of this is just for all of us to get our acts together and to look at ethics first, and that's really where we are going in my tender young age to make sure that that ethics within the profession is preserved and actually is enhanced, and that's my goal.
Yeah, I so appreciate that about you. And I remember when I first met you as Joe Steckler. Joe is the guy who created the Brevard Alzheimer's Foundation, and they call them Joe's Clubs to this day, named after Joe. And I remember meeting Joe like probably 12 years ago or something now, as he was first creating Helping Seniors of Brevard. Joe was 89 and going on strong. But I remember when I met him, he said, Kerry, he said, I've learned a lot of things through the work we do with Brevard Alzheimer's. He said, but I realize that sometimes people are fine, you know, with mental abilities and things like that as they age, but they're running into all sorts of other things. And we need a way to get information in the hands of people so that they can find really, and he really emphasizes this, trusted resources. And I know you were on the board of directors and have served in that capacity. You've been a friend all the way along, but you really are. I don't know that people know. I mean, they know you because they'll see, for example, you oftentimes publish a magazine with good dental tips that you can pick up at a grocery store. Sometimes it shows up in your mailbox. You've also written a book called The Ultimate Mouth Manual, but I'll bet a lot of people don't know how embedded in serious discussions you are throughout the dental community, really nationwide. You have a practice that helps other dentists run their operations, and then you were just published in a Journal of American Dental Association with some work that you and some of your colleagues have done.
Yeah, it's true. We are getting the message out there. We are looking at the message, and we've discussed, by the way, the message that's going into the Journal of the American Dental Association is the same message that we've actually been promoting now for over 2 years, and that was the fact that we have to be careful to, and it's something you referred to, that when we're performing periodontal services, that in fact the periodontal services are completely performed. And rather than just say we're doing something, we actually have to do it and we have to complete it. And that's the reason for the article in the Journal of the American Dental Association this month, and for the articles that we've had over the past 2 years. We've got to make sure that periodontics is not just a service; it's a service that actually accomplishes something, and that's our goal.
Yeah, I was looking at, because you were kind enough to send me kind of like an advance on the article, and you put in the cover note, it's our fifth article asking dentistry to set standards for outcomes in periodontal care. And I thought that's really excellent, because you're showing leadership in, showing other people how we're going to get this right.
It's true. And the whole idea, and by the way, the idea of guidelines is something that is prevalent in all of medicine and in most of dentistry as well. For some reason, and there are some reasons, there are political reasons, we're a little bit reluctant to approach it within our own field of periodontics. And that means if that's the case, you as a patient have to understand that there are parameters of periodontal care, that our expectation is that when you have bone loss and when you have something called a periodontal pocket, we expect that pocket is going to resolve through treatment. And if it doesn't resolve through treatment, then you need to put yourself in the hands of someone who can resolve that for you. It was a problem with regard to persistent dental disease, but now, given the fact that we have relationships between periodontal disease and nearly every systemic disease that's studied, whether it's Alzheimer's disease, whether it's heart disease, diabetes, low birth weight babies, I mean, we just come. Each disease that's studied has a relationship, and as a matter of fact, more than a relationship, between the disease of the gums. The portal of entry of bacteria into the body is the mouth. And so the disease of the gums is related to, and perhaps is, not even perhaps, and we've got evidence is contributory to some of the other diseases that are much more devastating than just losing your teeth.
And one of the things that I was going to comment about that is, I know we have done so many TV programs, radio shows over the year. And by the way, if you're new to this, I just want to let you know that you can find a great wealth of resources. You just visit helpingseniors@brevard.org. You'll find we catalog everything, because what we have discovered over the years is that people run into a certain situation and then they start like searching by topic. I need to know about assisted livings. I need to know about wills and trusts. I need to know about periodontal disease. People will hunt these things down. So there's a great search tool in there that lets you find all the TV, the radio, the articles we publish in the center section of Senior Scene magazine and so forth there. And I was going to say, one of the things that, particularly if you start searching for nutrition and things like that, is very interesting, because you, Dr. Sheldon, have taken a long time. I remember a show we did, I think it may have been last year, where you were citing a pretty significant study overseas where they'd been looking at the relationship between mouth health and heart health.
Yep, and we're seeing more and more of those studies all the time. Our really, if we're getting our message out, it would be that every physician knows this, that every cardiologist knows this, and makes a point of making sure that the patient is periodontally healthy as part of the cardiac treatment. This is important. And so, listen, it takes a while for that message to permeate, and we have to keep on pushing the message. Unfortunately, Kerry, it takes a generation, 20, 30 years for something that is discovered to actually become a part of everyday healthcare. And so we've got a little bit of a way to go. And frankly, I don't want to wait 30 years. I think we should be doing it a lot more quickly. But I've been going to integrated medical conferences. I went to one last weekend and one the weekend before. And one was on brain health, and this was a medical service that was reversing dementia in patients, and they were looking right at nutrition as being a source of that. Also, some of the medications they're taken that may be causing damage, and there's a whole field led by Dr. Dale Bredesen, Bredeson. There is the Bredesen protocol for mental health or for brain health or for dementia, something that that our listeners could take advantage of. Just go to Dr. Dale Bredesen, Bredeson, and see what he has to say. And there are Bredesen disciples who are opening up practices. I happen to be in Sarasota, and there is a practice that's opening up in Sarasota. There's already one in Jacksonville that follows the Bredesen technique with regard to dementia and Alzheimer's disease. Really, really important. But if you take a look at the website, and I forgot what the name of the website is, but just go to Bredesen, you'll find it. Periodontal disease is one of the factors that's causative in Alzheimer's and dementia as well. So they're recognizing it in their field. We're seeing it. I went to an integrated medicine and dentistry program the week before, and that was in St. Petersburg. And again, periodontal disease was at the forefront with regard to other degenerative diseases that we think have no cures, but in fact, if we do the right things, and part of that is nutrition, then in fact we can do a lot better than what we're doing right now.
And not only that, I was going to say, you seem to always spend your time linking these two things together, your mouth and your health. I think you covered in the Ultimate Mouth Manual, but, as we're talking about it, you explained to me once that to become a dentist, you don't necessarily get that much medical training in dental school. Everything is focused on the mouth, and that's one of the reasons why you on yourself have taken it to really study further on all these links and how it all interacts.
Well, I'd probably change that a little bit. We probably get more medical training in dental school than physicians get dental training in medical school.
Oh, wow.
They kind of skip right by the mouth. We actually are doing pathology, and we're doing neurology, and we're doing the basic medical medical subjects before we get into dentistry. So yeah, we do get it. Now, whether it's going to be presented on this kind of a basis, I'm not sure. I haven't been to dental school in a long time. I don't know. But given the fact that there is a dental systemic relationship which is being well recognized and which was proposed probably 20 years ago, it's permeating the dental literature. And if that's the case, then dentists or dental students are being taught at least some of that during their dental training.
Yeah, so a lot of times I guess we see these commercials, on television. They tell us we can have this pretty smile and all that. But I've always been intrigued with the fact that, while you guys are certainly tops in the field, I've done shows together with Dr. Matthew Sheldon, your son, who's an excellent general dentist and who talks a lot about, some cost-effective ways to do cosmetic dentistry. I really get that as periodontists, you and Dr. Sheldon Furtado, who's also in the office, you guys really understand and are looking really below the surface of what people are seeing to make sure there's good health there.
Well, there's no reason why you can't integrate health with decoration. And after all, what do people think of in dentistry? They think of decoration, perhaps having a better bite. Okay, we call ourselves solid bite. Okay, so being able to chew and to be able to smile is the main thing. But if all we're doing is that kind of work without understanding what's going on or without paying attention to what's going on below the gum line and making sure that our patients are healthy, well, we're not approaching the complete picture. And our goal in this practice, and not just our practice, there are many practices that are adopting this, is to make sure that not only we're decorating, but we're decorating a healthy mouth in the pursuit of having a healthy body. And if you look at this even further, Kerry, there are a lot of, there are some dental practices that are going into nutrition. They're talking about supplements that are looking at the toxic effects of some things that we may be doing in our lives that may not be as good for us. And given the fact that we have more time with the patient than the patient ordinarily has with the physician. We're spending an hour getting our teeth cleaned. We're spending more time with the dentist than usually we are with the physician. There is the opportunity, proposing that we become the front line caregivers for healthy lifestyles.
Right. And, again, like as an example, we actually did set a topic for today, and you're writing an article
Believe it
that's
or not, we set a topic for today. Yes, believe it or not, we do have one, and it's not this one, but that's okay. We can keep going.
No.
You and I have done this. We've set topics, and we've never even approached the topic. It just means we have another topic left over for next month, so that's okay.
Well, actually, to that point, let me go off topic for a moment and just add one more kind of postscript to the conversation we're having. Because it wasn't so long ago that you, together with our operations director, Nancy Deerdorf, who has 33 years of registered nurse experience. She ran the one of the area's premier, I would say, home health agency for all those years. And she's been on the board with Joe from day one, and very fortunate for us, year or two back, she volunteered to come off of the board and actually come onto the team. And so now she actually runs the Senior Information Helpline. But you two did a really intriguing conversation about nutrition and how it impacts the overall, all of these factors, mouth health, heart health, just body health in general. And it was fascinating to hear you guys, both who really know what you're talking about, have this conversation about how some things that were touted as being the right things to do maybe in the 1960s, further research and study shows that we're at a place that may not have been always the best idea.
Oh, we've got to be really, really careful. And by the way, I love Nancy. We had a great time in that show. We'll probably do another show together.
Good.
Again. But yeah, I mean, listen, if we summarize it, and I'll summarize my point of view, I'm not going to summarize Nancy. She can do her own. But the key is when you go to the food store, whatever food store you go to, do not shop in the aisles, shop in the periphery. In other words, get all the fresh stuff, not the canned and box stuff, and you're going to be in a much better position to have a healthy diet. So without studying, just go to the fresh fruits, fresh vegetables, go to lean meats, and go to the outside of the store, because that's not in the middle of the store. You'll be doing yourself a big favor.
Yeah, and again, all these programs that we've been talking our way through, these are all available to you at helpingseniorsofbrevard.org. You can always look for Dr. Sheldon's article in the center section of Senior Scene magazine. We publish 12 pages. John Frederickson's very kind. He allows our newsletter to go for a ride with his 12,000 or so copies of Senior Scene that he publishes every month. Goes out to 500 locations or more. Here in Brevard County, you can always pick up your copy free, and it's really another good, trusted resource in our area. So with that, drum roll please, we'll move into our topic, which is actually not a far stretch from everything we've been talking about, because our topic today, you're getting ready to launch an article on osteoporosis, which to me, Dr. Sheldon, sounds more medical than it would dental.
It is, and yeah. So why is a dentist talking about osteoporosis? I remember, Kerry. I did a TV program for a number of years, and that's where Joe and I met. We did a TV program, and I remember we were doing the program. And at that time, we had live call-in on TV. You've got to be prepared for anything.
Sure.
And we had physicians and nurses, and that was the typical type of person we'd have, and also paraprofessionals. We had them. So a caller calls and says, I can kind of figure out why the physician's here. I can understand the nurses here, but Dr. Sheldon, what are you doing on this program? Well, it was nice to be the host. That's good, but when we come to osteoporosis certainly has significant effects, and many people have osteoporosis, and some people feel there's a precursor called osteopenia. We can talk about the controversies there, because there is. But if we look at osteoporosis, that's something that many of us are suffering from. And osteoporosis, besides having a definite health effect, can also have a dental effect. And that's what we want to be concerned about, because we want to minimize the risk that a person has when they come to a dental office, so that if they are taking osteoporosis drugs, that in fact the dentist knows that, so that he or she can help you minimize any risk that you might have, particularly with any surgery that might be done in the dental office.
So I also like to go back to what I call almost the starting level, because one of the things that, at least I've seen, and I've heard Joe talk about this before along the way, is a lot of times we get more maybe advanced, assuming folks in the audience know many of the concepts we're talking about. I just want to back it up one level as we will dig deeper into this whole conversation, to talk about what if somebody is not familiar with osteoporosis. My layperson's view of it is I realize it's a bone, it's related to bones, and at least when we were kids, as we talked about this in a radio show, they told us drink milk so you'd have good bones and things like that. But maybe we start just there with kind of like going over osteoporosis.
Osteoporosis itself is a weakness in the bone. It is a problem of the metabolism of the bone, where bone turnover occurs, and when bone, because everything, whether it's our skin or bone, everything has some turnover. There are some cells that create new bone, and there's some cells that take away the old bone. And when things become out of balance, that's when we start to have weak bones, and we're prone to some fractures. And that's why physicians are so concerned about that. Now, understand, this isn't just a disease by itself. And understand, vitamin D may be important, milk may not be as important as we think it is.
Mm-hmm.
Understand that a lot of the bad things that we do, and I'm talking about cookies and candy and things in a box and sodas and all the types of things that we know are bad for our health, are not only bad for our dental health, they're bad for our bone health as well. And so that if we start to follow a rigorous, and that's not rigorous, maybe that's the wrong term, but a diet that is health related, where we're having fresh fruits and fresh vegetables, and that's where our concentration is, where we're doing supplements. And most people who are in the field, who are in the area of prevention, are taking supplements. I take about 30 supplements a day. You know,
Wow.
if we're looking for prevention, we're looking to make sure that we have the nutrition that we need in order to prevent the disease rather than treat the disease once it occurs. And so if we can do that, we're putting ourselves in a much better position. Understand that when you go to the food store, there is the enemy and there is the friend, and the friend is the fresh fruits, fresh vegetables, lean meats, all of those types of things, and the enemy is the processed food. So if we get more processed food, chances are we're going to have all sorts of problems with our health, whether it's gum disease or whether it's osteoporosis or any of the other diseases that we talk about on this show. Um, you can go a long way towards helping yourself by making sure that you get the nutrients you need in order to be able to make your body function as optimally as possible. When we're taking a look at the bone, then in fact the bone itself has turnover. There are two cells. One cell is called the osteoblast, and the osteoblast is what forms new bone. The other cell is called the osteoclast, and the osteoclast is the cell that takes away the old bone. And bone has a complete turnover, I think, in 7 years. So whatever you have now, you'll have different bones in 7 years. It's during that time of the formation of new bone and the removal of the old bone that you're either helping yourself or hurting yourself with good nutrition. And if you are if you have to take a drug, a bisphosphonate drug, or even some of the hormonal drugs, that changes the bone balance and changes the bone balance relationship. So if the bone is injured in the mouth, that it may not heal the way we want it to. And that's why we have to be particularly aware in the mouth that if we're on some of these drugs, that in fact we're taking precautions, and there are good precautions that we can take to make sure that we don't end up with a bone infection called osteonecrosis or bone death as a result of operating on the bone that's not that's not in the best condition.
Wow. We're talking with noted area periodontist Dr. Lee Sheldon with Solid Bite Dental. We're going to be into our mid-show break, but Dr. Lee, before we go, what's a good number to reach your office if you have questions about anything we're talking about, or maybe you're just looking for a good home to get some good help?
Yeah, just give us a call, 321-259-8000. 321-259-8000. Say you heard us on Helping Seniors of Brevard Radio, and you'll be able to come in for a complete examination, including all x-rays, including a CT scan, which becomes more and more important, particularly when we're talking about bone health. All for a $50 donation to Helping Seniors of Brevard.
Well, I'm all for that. So we're going to be back in just a moment with the second half of the Helping Seniors radio program. Stay tuned.
That music sounds good as we get the second half of Helping Seniors of Brevard underway. I'm John Harper, and it gives me great pleasure to introduce the host of Helping Seniors of Brevard and the executive director of Helping Seniors of Brevard as well, and that is none other than Kerry Fink. Hi, Kerry.
Hey, John Harper, thank you. It's good to be back for the second half of the Helping Seniors radio show right here on 90.3 FM, WEJF, and also hello to you listening online, WEJF.net, and those continuing on in our podcast. As you already know then, our guest today is none other than longtime friend of Helping Seniors. He's noted area periodontist. He's actually kind of internationally known, I would say, because he publishes a lot in places like the Journal of American Dental Association, and is often called on to help other dental practices serve their folks with excellence. And we're fortunate enough to have him right here in Melbourne, Florida. Hey, Dr. Sheldon.
Hey, Kerry, good to have you back for the second half. I hope we didn't bore you with the first half.
Well, it's all good. The conversation, and we're going to jump back to it in a minute here, that we left off as we went into it, was an interesting conversation, much like we often have interesting conversations where we take something that you say, well, you know, Kerry's going to talk with a guy who runs a dental office and has for many years. And so, we're going to talk about teeth. Well, in this case, we're actually talking about osteoporosis. And it's an interesting conversation. We're going to jump back into that, and we're going to talk about a little bit the relationship and some of the things you need to be aware of, particularly, I guess, if you're taking drugs that are designed to help manage that situation. So before we get there, though, I want to take just a minute and talk up a little bit of what's going on the Helping Seniors, kind of give a news organizations always do that. They get, they come back at the top or bottom of the hour and they give you, and here's the breaking news kind of thing. So I just want to take a moment and give you a little bit of breaking news about Helping Seniors, and it's all good stuff, and we need your help. So if you've been following along the story of Helping Seniors, Joe Steckler, our president and founder, organized this organization. We're now into our 12th year of service here in Brevard County. We operate the county senior information helpline, which is that free call to 321-473-7770. We handled well over 5,400 phone calls last year on that line from seniors and their families looking for help from everything from housing, legal, medical, financial, transportation, you name it. We probably got a call about it. Oftentimes from the senior themselves, many times from the family of a senior. A common occurrence is somebody who is an adult child is living up north, and they came down to visit mom, dad, aunt, or uncle and said, wow, a little overwhelming because they're not able to handle things the way we had hoped they'd be able to, and we need to get some help, some resources, and they don't know where to start. So they call us. Another thing that happens quite frequently, because just the flat out growth of our area, people are moving in and then they call us and say, well, I'm new to the area. Who do I call about this or that? And so that's the reason. That's one of the main reasons we exist. The other reason we exist is to get information and resources into the hands of seniors. And we really do try to do what Joe has always talked about, creating an aging plan, which is simply to make you aware of issues and things you might run into along your journey and to try to make that journey a little easier and a little bit more stable and a little bit more comfortable. And so we call it getting your ducks in a row, and we actually do a whole series of things about that. We publish, for example, in the center section of Senior Scene magazine, and our efforts are really all about getting information in your hands. So to that, what we do is we publish in the center section of Senior Scene magazine. You'll find 12 pages in there. Dr. Sheldon has an article in there typically every single month, and that's what actually led us down the conversation path. We're sort of previewing some of the topics he's going to cover in our June edition, which will of course be out 1st of June. It's a free magazine. You can pick it up. I think they print about 12,000, 14,000 copies every month. It's available at more than 500 locations around our county. And so each month, to help you on that development of your own aging plan, we try to use a different topic. And so, interestingly enough, for June, we're going to be talking about senior living options and call it a checklist. So you can kind of go through and see where you are on that continuum. July, we're going to cover your medical and wellness checklist, but I also want to make you aware of a couple of other things that you may or may not be aware of. We do what we call Senior Resource Center of Brevard events that happen actually now twice a month. We're taking the last Monday of every month and presenting either a panel discussion. It's absolutely free to attend. So, for example, on May the 22nd, Monday, May the 22nd, we are doing your senior living options checklist. We're going to meet 10:30 in the morning over there at Buena Vita Estates, which is right there on West New Haven Avenue. And Kara Anderson, who kind of heads this part of it up for us with Simplifying Senior Living, is going to have a great panel discussion. She's going to have Rachel McLean, who is case manager with the law office of Amy B. Van Fossen, Danica Carluccio with Advocates for the Aging, and also Ashley Caswell, who sits on our own board and has so much experience. She was expert with Hibiscus Court Assisted Living for so many years, now is in the IT business with a company called Raleigh, but she's still going to share on this panel. And then on June, if May 22nd doesn't work out for you, we're going to present the same panel on June 2nd, right back at one of the places we love so much. It's Zon Beachside. And again, these are morning panels. We are very diligent to keep them to no more than 55 minutes so that we respect your time. It's absolutely non-commercial. This is about getting information in your hands, not any kind of a pitch or anything like that. And we're seeing 30, 40 people show up for each of these who are serious about this. So we ask that you RSVP because we need to know how much food to prepare, because you get lunch and snacks and things like that. So you have to call 321-473-7770, and Nancy will help you get more information together and get you RSVP for that. Again, it's free of charge, and it's one of the things we do in the community. The last thing I want to say before we kind of jump back into our conversation, Dr. Sheldon, you have helped Joe from day one, so you understand that this has been a vision of his, he says, going back to the Brevard Alzheimer's days, of having a senior resource center where we can really assemble a lot of resources, tools, people, like-minded individuals who share the passion for getting good help to seniors in our county. And I mean, you've seen that all through with working with Joe, right?
Well, I saw Joe establish the Brevard Alzheimer's Association here and make it into something with the Joe's Clubs and making it into something that's viable. I think at that point, Joe said, I've got a new challenge. We've got to go beyond Alzheimer's. And Alzheimer's is included. Obviously, when we're talking about aging, we are talking about dementia as well. But he said, no, let's go a little bit farther. Let's cover all of aging. And that's essentially what Joe did. Methodically assembled a group of us who shared the same ideals. And that group has grown and grown and grown. If you take a look at the number of sponsors that we had when we first started, by the way, when we first started, we used to meet upstairs where I am right now, upstairs in my office. We would camp out there. But to look at the number of people who have now decided, hey, this has got to be part of my contribution to the county and to seniors as well. And I'm talking about companies. You look at companies saying, well, they're doing it for the profit. Listen, all of us are in business and we expect to make money. That's the idea. But there are certain businesses, and we hope many businesses, who say, I've got to put the customer first. I've got to put the patient first. That's the group that Joe has assembled. And so when you talk about some of the conferences you have, by the way, Kerry, let's do a dental conference someday, okay?
Let's
I'd
do that. I
I'd
love
love to
that.
do one.
I love that.
Everybody goes to the dentist. Let's talk about what's occurred. And yeah, I'm afraid that people take out their dentures in front of me, and that, but we'll have some ground rules going in. But the whole idea is when we spend our money, our hard-earned money, or spend our savings or retirement savings, we want to make sure that we spend it in the best way possible and get a predictable result. That's what Joe has done by assembling the network that he has. And so
Hmm.
where we've got members of nearly every business, every profession now. So exciting. And to have this kind of a resource where we have information for seniors, as well as being able to advise seniors exactly where to go in order to be able to get the services that you need, which is what Nancy's an expert in. Um, this is a tremendous boon for Brevard County, and not very many counties have this kind of a service.
No, it's true. We sort of had a pilot project going, as you remember, Dr. Sheldon, over at Zon Beachside, where there was 6 small offices. And to this day, we still make use because Greg Kennedy and Alfredo and all the fine team at Zon, they really serve with excellence, make available their Nautilus Ballroom for our community events, like the Senior Living Options Checklist coming up June 2nd. But when COVID struck and nobody could go in and out of assisted living facilities, we had to make a turn, and we like everybody else, became pretty much virtual during there. But Joe, as you know, Joe is tenacious, and so he got out letters, and he got Dr. Delegdish, who was the head of Omni Healthcare, intrigued and said, and he said, look, if there's something I can do to help further what you guys are trying to do, let me do that. And Joe said, well, could you help us organize so that we could have a space to continue this vision of a senior resource center? So, to make a long story short, we worked out a situation where we have now a 5,600 square foot space on the second floor of Dr. Delegdish's Omni Healthcare. They call it the Omni Healthcare Professional Tower. It's that 4-story building right over there next to the hospital on Apollo Drive. And we're so excited because we've been moving things in. We've got a meeting room there. We're going to have our media rooms there. There's so much things that we're going to put our senior housing task force in there. We're going to have our volunteer operation headquartered out of there, which really, for the first time, gives us a really effective way to start to work with that. In addition to having a lot of help from organizations who are in the same kind of space and want to help us fulfill our vision. I'm talking about folks like Jennifer Barton with Seniors Helping Seniors. She's moved her team in, and so they're kind of in the space with us. Vicki Moore, who is a licensed insurance agent, is in there with us. Denise and Todd Bergman with Senior Care Authority, who are kind of experts in helping folks find the best options for senior living, are going to be in there with us. And so we're going to have a lot of different. Oh, I forgot Ruth Rhodes, who's a attorney, elder law attorney, who serves on our board of directors, is going to have another office in there as well. And Jital Patel with occupational therapy is going to join us. So people say, well, what is the purpose of this? Well, the first thing I have to say, as a nonprofit, there is no exclusivity. We're for everybody who is for seniors. So just because somebody's in there with us, so for example, I may mention, Ruth Rhodes being an elder law attorney. There are 3 excellent elder law attorneys who are part of helping seniors of Brevard, and each of them will be doing various events and training seminars and workshops there in our space. But the idea is to get things so when a senior calls in with a problem on our helpline, we have some folks we can just walk literally right next door and say, okay, this is what's going on. How can we solve this? So, Dr. Sheldon, this is just an exciting day for helping seniors. I mean, it's 12 years in the making, but it's so fun to see this all happening.
And Joe had the vision. Joe had the vision. It isn't Joe says, let's do this and let's stop. Joe says, all right, let's do this. All right, what's the next rung? What's the next rung? Who do we get involved? Where can we go? Who's going to provide us with facilities, as Dr. Deligdish has? I mean, this is just next and then next and then next and then next. And we used to enjoy doing this radio program together with Joe. Joe has
Yes.
more important things to do now. So it's Kerry and I, and Kerry and the monthly guest or the weekly guest that do this along with Jim Voto and John Harper. It's you create it, and then you let qualified and talented people do your thing, and then Joe creates something else and puts in that infrastructure, and then Joe moves on to something else. And at 89 years old, look at what he's doing.
That's true. And I have to say this, Dr. Sheldon, literally, Joe and I were talking last week. One of the things we are so excited about is that Jim Votro and John Harper have brought some technology to allow us to be able to do some remote broadcasts and things like that. So we're actually anticipating getting Joe to guest star on a couple of radio shows as we move down the road here. So Joe, he's not done with any of this. There's nobody who's a better friend of seniors, I think, in this whole county. But anyway,
right. And he goes to county commission meetings. I mean, Joe's there.
Yes, yeah, he's the man. So anyway, if you want to learn a little bit more, there was a great article. Our friends at Hometown News published it was actually a cover page article in some of the editions about the center. You can certainly find out more about it on our website and on our Facebook page. So I encourage you to visit helpingseniorbrevard.org. But as we continue, I want to circle back to this conversation we were having about osteoporosis, which is, again, interesting. You as a periodontist, somebody that does a tremendous amount of work in the dental world, you and your colleagues are putting articles together in the Journal of American Dental Association, things like that. But one of the things that you felt was important to share with our audience is that the fact that when people come to see you and they're having medications for osteoporosis, sometimes that creates some complications that you're required to try to work through so we can do all these things safely.
Exactly right. There are two different basic kinds of medications. One is the bisphosphonate drug, and this is one that interferes with cellular function so that the bone resorbing cell, the osteoclast, no longer works. Well, that can provide, that may be good for increasing bone density, but it provides, for some people, difficulty in bone healing. And then there are the hormonal drugs, which also limit the cellular turnover within the bone. And if you have that, we just had a patient last week. She'd had her tooth extracted by somebody else 3 or 4 months ago, and she still has an infection. And we looked at it, and this is an osteonecrosis of bone as a result of the medications, the osteoporosis medications that she's taking. And so we want to prevent that. There is a way of preventing that. If you've taken one of these drugs for 3 years or more, and that seems to be the limit, at least for the bisphosphonate drug. And the bisphosphonate drug is Fosamax and Actonel and Boniva. Those are the 3 most popular ones. There's also some injectables. Forteo, I think, is the one that I can think of right now, but there are others. If you're taking those drugs for less than 3 years, then you're not susceptible to this osteonecrosis or death of bone as a result of a tooth extraction or some kind of oral surgery. By the way, this occurs in the mandible and the lower jaw. It doesn't occur, to my knowledge, in the upper jaw as well. But what we're trying to do is prevent that from occurring. And so there are, if you have taken that medication, number one, there's a test that we can run, a blood test that we can get done at Quest Labs called the CTX test. And that will give us some indication as to where you are in terms of your ability to heal. And then we want you to be on a drug holiday for whatever length of time it takes to get that CTX test back to normal before we do the surgical procedure. Now, if the surgical procedure is an emergency, well, we have to do it. But if we can put that surgical procedure off and get all of, as you were saying, in the senior living plan, get all our ducks in a row, it's far better for the patient to be able to prevent him or herself from getting osteonecrosis than having to treat it afterwards.
I think it's so imperative that people sit down with somebody when you're talking about medical care, dental care, things like that. If you don't have somebody that's really thinking through all these, possible I guess, areas, that the average person, I guess, we wouldn't even know to think about something like that. So it seems like it just really emphasizes how important it is to make sure that you're working with medical dental professionals that really take the time to know all these nuances.
It's true. You have advantages now that we never had before because we have the internet. And so you can go to Mayo Clinic and go to WebMD, you can go to different places and say, all right, what are my problems with osteoporosis drugs? And they will spell them out for you. Or read the label. You've got, there's a package insert on every drug that you get. I know it's a lot of fine print, but there is something that does talk about side effects or health effects from using this. Read that just so you know what could be there. Ask your pharmacist. Pharmacist is local, and your pharmacist is happy to discuss some of these problems with you. So there are resources out there, and then of course make sure you're seeing some qualified people who can help you in in whatever dental surgical avenue you're in.
Yeah. Well, and one of the things I want to kind of like maybe put a bow on top of this by talking about a way, because Helping Seniors is a nonprofit organization, and we can literally only go as far as you will help us go. I'm talking to you if you're listening to this show, if you're a person, if you're a business. There are ways that you can help keep the work of helping seniors going forward. And so one of the really creative and wonderful ways to do that is you guys have helped us for a number of years. You do it through a program, I think it's called Solid Bite Gives Back, but it really seems like a win-win-win. Can you just kind of summarize and explain how that works? Because it's a great tool.
The Solid Bite Gives Back program was essentially our practice's idea to be able to support local charities, of which Helping Seniors is a prominent member of our group. We support other charities as well, but that is not our consideration. That's the patient's consideration. So if the patient says, I want to come in and see you and I want to support Helping Seniors of Brevard, then you bring in a check, you write a check to Helping Seniors of Brevard for $50 or more, and you get the complete examination at no charge. This has been tremendous, and I believe we've gone at least, I know we went over the $200,000 mark a couple of years ago, so we're probably close to $225,000 or $250,000 in charitable donations that have occurred as a result of this program. It's a win-win for everybody. Patients come in, they like the idea, they can pick the charity they want to support, and of course, Helping Seniors of Brevard is what we're talking about here. It gives the charities an opportunity to thrive, if you will, and the patient the opportunity to see what. Listen, it's not my practice anymore. This is a fantastic dental practice. To come into a fantastic dental practice knowing that the work is going to be done well, it's going to be guaranteed. This has been a dream of mine to be able to establish a legacy. I no longer do the work. I do examinations. That's all I do. But to be able to work with these guys, to work with Dr. Sheldon Furtado and my son, Dr. Matt Sheldon, and see the consistently great results they get, and to see how they're pushing the envelope and going even farther and farther and farther, and to make sure that we're providing the best in dental care, not just in Brevard County, but around the nation. I mean, the things that they're accomplishing here are things that I will put up against any practice anywhere.
Yeah. Well, certainly I'm not going to argue that fact. How do people reach you if they want more information about anything we've talked about, or maybe they say, okay, I'm up, I want to help you, help me, and helping seniors. I have some great people right here. You've got Lindsay, you've got Kathy, you've got Amy, you've got Jennifer, all of whom know what's going on within the practice. So if you have questions, you want to take advantage of the Solid Bite Gives Back program, just give our office a call, 321-259-8000. All right, thank you, Dr. Lee Sheldon with Solid Bite, doctors Sheldon and Furtado. And in the moment I have left, I'm also going to say there's another way you can support Helping Seniors. That's get your Helping Seniors car raffle tickets. So you can call Nancy at 321-473-7770, or you can go to Helping Seniors of Brevard, Helping Seniors Travel Club. .com is a great way to do that, or you can just go to helpingseniors@brevard.org. There's a link there too. But basically, when you buy a ticket, 1 for $25 or 5 for $100, you're supporting the work of helping seniors. You might go home in one of 5 brand new cars from AJ Hires dealerships, a great partnership that AJ and Joe Steckler established literally back in the 90s to raise money for charity, and it really helps keep our little organization going. So when you buy a ticket, you could go home in anything from a Dodge Challenger to a Chevrolet Camaro to a Mazda Miata to a a Kia Sportage, and this year we're even adding in a Mitsubishi Outlander because AJ has added a Mitsubishi dealership to his roster. So, and the biggest fun of all, while you don't have to be present to win, is Saturday, October 7th, 2023. We have a big night out at Mark Pylock's Astounding American Muscle Car Museum. So you got to get your tickets, Helping Seniors carraffle.com, and each ticket you get is admit one to the museum. So you get 5 for $100, and it's you and 4 of your best friends. So we sure do look forward. Thank you, Dr. Sheldon, for being with us today, and we sure do look forward to seeing you next week and every Wednesday at 12 noon right here on 90.3 FM.